Protecting a community from a hidden health threat is like protecting the chocolate hills of Bohol from a silent spreading wildfire. You cannot personally inspect every blade of grass. You will always be too late. That is why Bohol has a watchtower, an early warning system. Our product, Chris, is exactly that, a watchtower for public health.
Now, when we enter a new community, we are fighting this fire with our eyes closed. We either have no data or all the data is in paper, which makes all the house. So now, let's name the problems. The first one, we can't identify the risk patients for given extension and diabetics efficiently. Two, we can't relate the people's demographics, age, gender, location on disease prevalence. Three, the traditional ways is inefficient. Well, yeah, we can collect blood samples using syringe. It's good for an individual, but if we talk about the whole village, it's really inefficient and impractical. It also creates a lot of medical waste. It's also invasive for nature. 4. Currently, there is no way to measure the effectiveness of medical treatments for people. And fifth, the data blindness. From paper records, we have a lot of paper data of what is good and what is bad, but we can't build a unified health system for a single patient, not even for an entire village.
What if you could see the entire village's health in one picture? The entire data visualized in the form of a health census in just a few hours.
Introducing Chris.
Community, health, and rural intelligence system.
Is where our solution begins. Chris has three core parts. The first one is a tester, a simple, non-invasive band that is completely safe. It has no cultural barriers, it has no medical waste, and of course, it has no needles. We give one band to every person in a village. People just wear it for a few hours and perform their everyday tasks. There is a sensor inside the band, which can be tailored. One time screening for diabetes risk, or the other time for hypertension. This specific technology can evolve, but the intelligence system behind it all remains the same. The band is like a watchtower. You might be wondering, we are going to wear our band for a few hours a day. What if it breaks? Well, no worries. We are going to wrap it up. Our protective design is kind of like bubble wrap. Our protective designs protect our band from any fall damage, any pumps, any water, or any other adverse condition the environments of Bohol can throw at us.
This is the hub. It works offline and is also built on simplicity, keeping our users in mind. And press buttons to record conversations and make digital health records. But the real intelligence is in this risk score. We basically take the sensor readings and combine them with basic health information like sugar, blood, age, and blood pressure levels in order to calculate a personalized risk level for each person. So we basically start with a threshold-based formula, but as we collect more data, the system can be converted into a machine learning model for future purposes.
It's crucial to understand the risk score is not a diagnosis. It is a screening and prioritization tool. It doesn't tell you if someone has diabetes, but it flags with high probability who in a village of thousands is at the highest risk and needs clinical attention first. Simultaneously, the system securely converts all this risk data and the resulting medical actions. That means every prescription, every note from the doctor into a single lifelong digital health history for the patient. This eliminates paperwork, chaos, and makes every patient's story one click away for any health worker forever.
This is where it all comes together. Our smart dashboard system now can visualize the data. So now a project manager can say, our next health camp should focus on cluster 7. These 20 people should follow up first, and we instantly get mobilized resources.
Our model solves all the targeted problems. Number one, identifying at-risk patients. Well, that is what we do. Our real-time risk score calculation pinpoints individuals with potential diabetic and hypertension risks.
Second, our data lets us evaluate what works. By linking risk scores to demographics like age and gender, we can see which treatments are most effective for different groups. We can then use the same CRIS system to rescreen the village, proving our medical interventions are actually improving public health.
Our rollout is a three-stage process made for maximum impact.
Step 1 is our proof of concept at HKUSG. Here, we test our model, the band, the hub, the workflow, in a controlled environment. Imagine this as like a technical rehearsal of our main mission at Philippines.
Step 2 is model calibration in Bahol. We work with a small size of group, including knowing passions and piloting our innovation in Philippines. This is where we gather data to create a precise risk score formula. This isn't a guess, it's science.
Step 3 is scale and learn. Once we have enough data, we evolve from a threshold foundational model to a machine learning model. Now we deploy our calibrated system. Moving forward, our machine learning model learns, refining its predictions to become an even more powerful tool for the entire community.
We design CRIS for real people. The interface is so simple that any people can use it. Students, nurses, or any local health worker.
This isn't a one-time tool. CRIS becomes the village's permanent healthcare record system. When the doctors return after implementing medical solutions, they can use our system to track the effectiveness of the medical solutions. If they work for a particular person, particular age group, particular gender.
This creates a sustainable cycle. Screen, then treat, track, and improve. The system gets smarter, making healthcare database management long-term.
But there is more. People get real reasons to go to these free camps. Free food, medicine, clothes, and stuff targeted to whatever the villagers is needed. And most importantly is community. By doing this, we're turning coming to a health camp from something you do only when you're sick to something you actually want to do, even if you feel actually really fine. So, how long do people need to wear this band? And why will people wear these bands? So, Philos Health organize camps. And that's our foundation, our basic. But our idea is to transform health into the base of community life. People wear our bands while we're doing some running errands, they're living their life, talking with neighbors, cooking some food, and that's where the magic happens. We are gonna invite some high school students to help us. This isn't just about data, it's about connection. High school students will cook together with some villagers. They will talk, make new connections. Elders can teach some kids how to cook some traditional recipe, where laughter erupts during a friendly game, and where music flies in the air. In these moments of cooking, playing, simply being together, everyone wears the bands. We are capturing the most vital part. We are capturing more than just a vital signs. We are capturing the heartbeat of community life. And also, this way keeps the bands safe. So we came to the Philippines with 5 bands. Firstly, while Philos runs a health camp, we hand out these 5 bands. Why just 5? Because we test 5 different people at different times of the day. So by one day, we have tested 15-20 people in total. We repeat this for a few days and our system gets smart.
Our main aim with CRIS in Philippines is to set it up in such a way that we can scale our model from 5 to 100 bands. So now you have got a super clear picture of what the priorities are, who to cure, and how to help the people.
Our system deepens the relationship between the local Barangay Health Center and Philos in tracking people at risk, spotting illness before it hits, and standardizing how information is collected, even without the internet. Our database allows us to give step-by-step plans to the organization's project manager on who to help, how, and when. How often do we use the armbands to make decisions? For new camp, we start with mass screening. Build up a health profile for each person, then make a plan using that information. After that, we track how good the solutions are working, and lots of times we do monthly check-ins to catch any new health threats, those that can be measured using the armband's non-invasive sensors. Perfect for stuff like diabetes and hypertension, but because of the medical tracking, if something else pops up, we can catch that too.
Let's be real. These bands are around 100 HKD each. Yes, it piles up over time for thousands of people. But here's why it actually makes sense. One band can serve hundreds of people for years. Unlike one-off test that gives you just single number, it costs time, travel, and money. With these bands, the reading is just the beginning. The one-time cost unlocks a continuous system of information. all flowing directly into CRIS, our database management system. No more wasting resources on scattered paper based info that sits on filling the cabinet. That's the real shift. The band is just the tool. It's CRIS that gives us the whole picture, tracking trends for the entire village, spotting patterns we could never see before, and flagging risks early. So, yeah, this is an investment. But it's not an investment in a device, it's an investment in a smarter, more efficient system that leads to better healthcare for everyone.
So, what does this change? Everything. Instead of months of guesswork, you get a full health consensus in hours. Instead of wasted supplies, you get perfect resource allocation. And instead of paper that gets lost, you get a full digital health record that lasts a lifetime.